Hello, did you know that according to a study published in Geroscience Journal 2K23, with gradual aging, one of the key components of our body, something indispensable, begins to get depleted. Unfortunately, the body cannot synthesize on its own unless supplemented, which places us at a vulnerable stage for several major medical conditions. These range from cognitive decline like poor memory, difficulty concentrating, slower learning, and with the old age, there is increased risk of neurodegenerative diseases like Alzheimer's to cardiometabolic conditions like early onset type 2 diabetes mellitus and cardiomyopathy risk. So once again, a warm welcome to everyone. My name is Nitin Vijay Kumar Devdare, a former student of Associate Professor Levchenkova Olga Sergeyevna. So today I am going to unravel the importance of omega-3 fatty acids and help you to get well acquainted with it. But before diving into omega-3 fatty acids, let us first understand the broader classification of omega fatty acids. Omega fatty acids are a group of polyunsaturated fatty acids abbreviated as PUFA that are commonly classified into three major families: omega-3, omega-6 and omega-9. Omega-3 family includes three individual fatty acids, namely ALA, that is alpha-linolenic acid, DHA, docosahexaenoic acid, and EPA, Eicosapentaenoic acid. Similarly, omega-6 family contains linoleic acid and arachidonic acid, and omega-9 consists of oleic acid. Since omega-9 can be produced in our body, making it a non-essential fatty acid, unlike omega-6, which is an essential fatty acid, but fortunately omega-6 is present abundantly in many dietary foods. Very rarely its deficiency occurs. But unfortunately, omega-3, an essential fatty acid, is not present in wide variety of foods, especially vegetarians are on high risk. A global nutrition review found that 76% of people do not consume DHA and EPA, placing us on vulnerable stage of deficiency. And it's worth noting that in our body, ALA can be converted into DHA and EPA, but its amount is nearly negligible, so making this process practically nearly of no use. That is why today our major focus is on omega-3. Omega-3 comes from the Greek letter omega, the last letter signifying the end of the fatty acid chain, while the 3 denotes the location of the first double bond, counting 3 carbons from the omega tail. Here's the structure of it. And the recommended daily value intake for omega-3 fatty acids is as follows. ALA is advised 1.6 grams per day for men and 1.1 grams per day for women. Additionally, a combined intake of at least 250 milligrams per day of EPA and DHA is recommended for optimal health benefits. And to effectively address the omega-3 fatty acids deficiency, we can turn a variety of rich sources. For ALA, plant-based sources include flaxseed oils, chia seeds, walnuts and canola oil. And when it comes to EPA and DHA, the most potent sources are animal-based, such as oily fish like salmon and mackerel, krill oil, and those seeking for an vegan alternative, it is algal oil. And now coming to the most important aspect of our presentation. But before, let me ask you, what do you understand the difference between therapeutic role and prophylactic role of a supplement? See, it's simple but significant. Therapeutic role's main purpose is to treat an existing disease, condition or symptom, and prophylactic role purpose is to prevent the onset of a disease or condition before it occurs, and omega-3 has both. So now first let's discuss the physiological role and therapeutic role, which are matched with the same colors respectively. Firstly, hypertriglyceridemia. Omega-3s reduce the production of VLDL, very low density lipoproteins, in the liver, which are the main carriers of triglycerides in the blood, ultimately lowering the triglyceride levels and aiding in hypertriglyceridemia at doses greater than 2 grams per day of supplementation. Moreover, in atherosclerotic cardiovascular diseases, omega-3 fatty acid, that is especially EPA, integrates into cell membranes and reduces the vascular inflammation and platelet aggregation. This leads to stabilization of atherosclerotic plaques and improved endothelial function, thereby lowering the likelihood of plaque rupture and major myocardial events. And now let's discuss the prophylactic uses of the omega-3 fatty acid. Fundamentally, in brain function, DHA is an essential structural component of neuronal cell membranes that is in gray matter and plays a crucial role in brain development and synaptic function. Adequate levels help maintain neuronal signaling and cognitive performance, while deficiency may contribute to neurodevelopmental disorders such as ADHD, that is attention deficit hyperactivity disorder, and neurodegenerative conditions like Alzheimer's disease. But here's the twist. While marketing claims that omega-3s treat dementia, which are of course unsupported and exaggerated, Evidence-based discussions about their potential preventive benefits when backed by rigorous long-term studies in the health populations are more credible. To confidently recommend omega-3s like DHA for dementia prevention, research must demonstrate a causal relationship, not just correlation, and account for co-founding factors such as genetics, diet, and lifestyle. 1.5 to 2 gram per day of combined EPA and DHA is considered to have a better effect on cognitive function. Subsequently, in eye health, DHA is a major structural fatty acid in photoreceptor cells of retina, where it helps to maintain membrane fluidity and proper visual signal transmission. Adequate DHA supports normal retinal function, while deficiency may contribute to tear film instability and dry eye disease. Next, omega-3 fatty acids exert anti-inflammatory effects by reducing the production of pro-inflammatory mediators such as cytokines and eicosanoids. They also help maintain the skin barrier integrity and regulate immune responses, which is why they help reduce the inflammation conditions like rheumatoid arthritis and atopic dermatitis, that is eczema. Then help improve the insulin sensitivity by enhancing how cells respond to insulin by reducing the inflammation in the metabolic tissues. This supports better glucose regulation, making them beneficial in type 2 diabetes mellitus. Finally, in pregnancy and early life, particularly DHA and EPA help regulate prostaglandin and inflammatory pathways in the uterus, which can reduce uterine contractions and inflammation, thereby lowering the risk of preterm labor. Now moving on to its preparations, they are broadly categorized into 3 divisions. Let us understand one by one. First category is dietary supplements. Their purpose is to provide nutrients that may be missing in diet, not intended to treat the diseases. That's why cannot legally claim to cure or treat illness. Their regulation is less strict, no strong requirement to prove effectiveness for treating diseases. And as of Russia, dietary supplements are recognized as Biologicheskие Aktivnie Dabavki, which is abbreviated as BAD. Here are some Indian brands like TATA, Muscle Blaze, and Russian brands like Yevlar, etc. Then the next category is nutraceuticals, which are food or parts of foods that provide health benefits beyond basic nutrition, sometimes helping prevent or manage diseases. There is a thin line of differentiation as they fall between drug and supplements. Claims are often limited to health benefits but not formal treatment. As of India, this category is differentiated with dietary supplements regulated by a well-known FSSAI Authority. But in Russia, there is no strict differentiation between dietary supplements and nutraceuticals. The examples are Omega Veda, Neuro Omega, etc. And lastly, the drugs whose purpose is to treat, cure, prevent or diagnose the disease, strictly regulated by the authorities like FDA, require clinical trials to prove safety and efficacy. Drugs have specific therapeutic claims and dosing is carefully controlled. As of Russia, OMAKOR is the only brand widely available who sells omega-3 as drug and claims to treat type 4 hypertriglyceridemia along with hypertriglyceridemia type 2 or type 3 but in combination of statins. And in India, it is Lovaza drug which claims to treat or lower very high triglyceride levels. And last of all, so more than 3 gram per day of EPA and DHA is considered high dose and should be taken only under medical supervision. High doses of EPA and DHA can alter cardiac membrane electrophysiology and atrial conduction, which may predispose susceptible individuals to atrial fibrillation. Omega-3 fatty acid also inhibit platelet aggregation by reducing thromboxane A2 synthesis, leading to prolonged bleeding time, particularly when taken in high doses or with anticoagulant therapy. Additionally, increased intake of omega-3 fatty acid can stimulate bile secretion and lipid digestion, which may irritate the GIT tract and result in nausea, diarrhea, dyspepsia, and fishy reflux. Furthermore, high doses may cause a slight increase in LDL cholesterol levels, which is an important consideration in patients with cardiovascular diseases. Now, let's answer some questions. Should everyone take omega-3 supplements? See, while aging is the primary risk factor for neurological diseases, the progression and onset of these conditions are also significantly influenced by modifiable lifestyle factors such as poor diet. Prospective epidemiological studies suggest that people who consume diets rich in antioxidants, unsaturated fats, and especially fish and fish oils, which are of course high in omega-3 fatty acids like DHA and EPA, have reduced need for omega-3 fatty acid supplementation. Next, how can we check omega-3 is deficient? Well, omega-3 index test is considered the gold standard because it reflects long-term incorporation of EPA and DHA into cell membranes. So this is the real report of the patient named Emma Sutherland. Let's understand how it is analyzed. So here's the table with clinical interpretation. Less than 4% is deficiency, and which may induce cardiovascular risk and associated elements. Range between 4 to 8% is suboptimal but not deficient, and level more or equal to 8 is normal level of omega-3 fatty acid and is considered safe. And lastly, let's see the typical doses with recommended DHA plus EPA ratio for specific health goal. As of cardiovascular disease, it's 2500 mg per day with 3:2 ratio. For cognitive decline, it's 1500 to 2000 mg per day with 1:2 or 1:4 ratio, where DHA is almost double since DHA is the part of gray matter in brain. And in pregnancy, 350 to 450 mg per day, as here also DHA ratio is double of EPA. Now, before buying, here are some points necessary to keep in mind. First, purity and safety. For quality check, there are third-party testing authorities like IFOs, NSF, USP for purity, potency and freshness of product, and ensure the product is free from mercury and other toxins. Secondly, opt for triglyceride or phospholipid form of omega-3 supplements, as these forms are better absorbed than ethyl ester forms, which are cheaper but less bioavailable. Thirdly, source of omega-3, as there are different sources. Each source has additional benefits like krill oil contains omega-3 in phospholipid form, which may enhance absorption. It also includes astaxanthin, which is a very potent antioxidant. And last but not least, just like in life, don't forget the purpose. Always ensure you know why you are taking omega-3 supplements, whether it's for heart health, brain function, anti-inflammatory benefits or pregnancy, because different doses and ratios of DHA and EPA are tailored for different conditions. So guys, if you genuinely felt the information helpful, do share, subscribe and share with your colleagues and friends. So here I take a leave. Thank you. Thank you for your attention.